Okay, so this half is going to be kind of serious. We're going to go over something I find frightening that she said. Dani said if she gets any kind of weight gain, she's going to go off her Seroquel. And that is a frightening statement to make. So your weight is more important than control of your brain, of your mind. That doesn't make sense to me. There are a lot of things doctors can do and that you can do yourself to prevent the weight gain and keep your brain safe and your moods stable by taking your medication. Priorities, people. Priorities. First off, 3 eggs, 6 pieces of bacon, and 2 pieces of toast when you're not doing anything is really too much food. You're not on OMAD, Dani. You need to really cut down on the fats, on the processed foods, on you're eating so wrong. Increase the fiber, decrease the fats, no more processed foods, period. No fast food, period. No soda. I mean, there are a million things you can do. And most of all, you need to force yourself to exercise, no matter what. Not this sporadic dancing, not every once in a while taking a walk. And I understand you have asthma and you have it pretty badly. You should really give up the vaping and smoking, because I know you quit smoking, but the vaping is not helping. First off, let's make this very clear. Never go cold turkey on a neuroleptic. Okay? That is so dangerous. Neuroleptic drugs, of which Seroquel is one, block dopamine, the receptors for dopamine. Because unfortunately, while dopamine gives us the pleasure of things in our lives, it also is the place, the chemical that handles hallucinations and delusions. So you have to block it. And that's what Seroquel does. There's 3 kinds of neuroleptics. There's the first generations. Those are your old-time drugs like haloperidol, Haldol, Thorazine, things like that. You have your second generation neuroleptics, clozapine, things like that, risperidone. I think everybody up here is on risperidone. And then you have your atypicals, ziprasidone, things like that. These are drugs most people never hear. But you may have a relative who has bipolar with mania. You have bipolar with depression. You have schizophrenia. Seroquel is one of the best drugs. It has a lot of side effects. Now, Seroquel can be used for ages 10 and up, which is awesome. It used to be lithium. You couldn't be under 16 to receive it. I don't know if that's changed. I have not kept up on it. But I've told people before, when I would go on calls with my mom, she had this one client that I just loved. And he's a little dude. His name was Charlie. And he had this old army style cot that he slept in. And under his cot, he would always say when we walked in, do you want to say hi to my friends? And we'd be like, okay. And mind you, Charlie had a sister and 3 brothers. One brother was at Napa Children's Psychiatric, and the other 2 were fine so far. Charlie was 10, and he would take you by the hand into the bedroom, and he would get a saltine box that he had cut the end out of, and he had cut little windows into the sides, and he would tell you and show you all his friends that lived inside the saltine box. And he would tell us that it would light up at night, and that's how he knew they were awake. And then they would have fun all night long. And he was the sweetest little boy. I've always wondered, I mean, he'd be in his 20s now. I always wondered what happened to Charlie. His father was a paranoid schizophrenic, which is not a term that's used anymore. It's now schizophrenia with paranoid type delusions or something. And his oldest brother did, and he did. And as I recall, before my mom retired, I believe it was the sister was showing symptoms, and she was 5. The sad thing was that they couldn't give him lithium. And lithium seemed to control his brother, who was older, at the live-in hospital. His father, who was at Atascadero, which is our prison in California for the criminally insane because he had murdered someone during a delusion. His mom was also schizophrenic, but she was very well controlled on Haldol and Thorazine. As I recall, his brother was on stelazine and lithium, I want to say. And Charlie was too young. And so luckily his delusions were very friendly and very happy. And I'm not giving you any HIPAA violations because that's not his name. And we nicknamed him Charlie because that was actually the nickname he picked for himself. And I don't remember his friends' names. Honestly, I don't. I just remember the saltine box. But now Seroquel came out, and there's a million drugs that have come out in the last 20 years, and they all have side effects, and they all do varying things to help those with severe mental illness. They are all classified as antipsychotics. Quetiapine fumarate, or Seroquel, is probably one of your more commonly prescribed atypical second gens. It falls into both. It is used for schizophrenia. It is used in conjunction with lithium or say Haldol, or it's a standalone. You just use it alone for bipolar 1, 2. It also is helpful for people with bipolar on top of major depressive episodes. So as you can see, the most common side effects. What are you ripping, sir? Oh, your flower. It's okay. We have a little rippage going on from the knife box. This is his sunflower, which he has pulled all the petals off of, which is okay. So your more common side effects of pretty much all of them is weight gain, lethargy, just no energy, kind of nausea, the dry mouth thing, increased appetite because the dopamine receptors affect all those pleasure centers like eating and going out and doing things and being active. It does create dry mouth problems, and it has a tendency to raise your liver function values, which can be dangerous. There are drugs you should never take or take with caution when you're on Seroquel. The ones that I worry about with this one is bronchodilators. Anyone with asthma using a bronchodilator needs to be careful. Cold and allergy meds like Benadryl and Dramamine, of which hydroxyzine is in that class. And over-the-counter and prescription stomach medicines like Tagamet, Zantac, any of those. Generally, everybody finds they have some side effect. And the weight gain is probably one of the more common ones. Now, you never go cold turkey on a neuroleptic because remember, you're blocking the dopamine receptor. To suddenly stop means those receptors open and the dopamine floods in. That creates an extreme emotional distress. Remember when she was crying in bed a couple weeks ago and she said she hadn't been able to fill her Seroquel? Yeah. Now think of that times 1,000, and that's what the withdrawal is like. Worse off, even with tapering, the withdrawal can take weeks to months. Some people have reported over 1 year before they felt normal again. Now, there's a rare side effect that can happen called NMS, and it can happen with any neuroleptic. And it's called neuroleptic malignant syndrome. It's very serious. Your muscles suddenly become rigid, and you have trouble breathing, moving, talking, swallowing, everything. It is frightening. Also, people get tardive dyskinesia. So facial twitching, body twitching, muscle twitching. This can be small in nature all the way up to violent. And though TD is generally not fatal, it is life-altering, and that can last for months. Now, when Dani says she's on a high dose, she is not. 300 is generally your starting dose. 800 is usually what they top you out at. So 300 is not top dose. She can go up again if need be. She's going to give it a month. It takes actually about 6 to 8 weeks for Seroquel to even out because you're altering brain receptors. And you have to think of, I don't know, you have to think of what the mechanism is happening in your brain to understand why it takes so long. You don't just change your neurologic pathways in the blink of an eye. It takes time. Let's get to metformin. Dani, I want you to say it with me. M-E-T, met. F-O-R-M-I-N. Formin. No A. Metformin. Stop leaning on a learning disability. That is not why you guys pronounce things wrong. It's because you have what is called lazy speech. You go so fast that you are lazy in enunciating your words. Sorry, Milo's climbing on me. It's lazy speech. You need to slow down. You need to think. If you can't slow your brain down, you need to be altered on your ADHD med. So in the old days, we called metformin glucophage. Glucophage, okay? Sounded better, I think, than metformin. Metformin, I don't know why, always reminds me of Batman. I don't know why. Don't ask me. It's just one of those weird things in my brain. So metformin comes in a lot of things, okay? Added with or immediate release, extended release, most drugs nowadays. If you have kidney disease, you have a problem with glucophage, okay? Metformin. I got to stop saying it. I love this website. It's probably one of the better ones. Straight Healthcare. People with lower kidney function, kidney failure in varying degrees, dialysis patients, kidney damage from previous infections, scarring, polycystic, everything. You have to be very, very careful because as it goes through the kidneys, it is very hard on the nephrons, the little filters like whale baleen that are inside your kidneys that help to filter toxins out. If you have liver disease, because it is processed through the liver, you have got to be very careful. So they have their own dosing schedules. So here you have your dosage for tablets, 500 milligram, 850s, 1000s, okay? I'm just going to go quickly through this. Metformin is Fortimet, generally sold under that name. Metformin ER is Glumetza. Then you have it with another medication, and it's called Janumet. We have a lot of people up here on Janumet. These are all diabetes drugs for type 2 diabetics. It is also our first line drug for hyperglycemia. Let me make sure I get that clear. Hyperglycemia. So I try to find you guys a website that will tell you good information. And believe it or not, I found it on a site called joinfound.com. It's kind of tricky to find the information, but it's on here. And as you can see, metformin dosage for treating antipsychotic induced weight gain. Believe me, this beats, for the layman, this beats reading and struggling your way through like a Lancet article. Trust me. This is written for everyone to understand. Now, Dani's taking 500 milligrams. She says next week they're going to bump her up to 1,000. That is normal. That is not high. High dose is 2,550 milligrams a day. Okay? Metformin was found to only help 5% of the patients. That's not a lot. What it's called is a weight loss neutral drug. It doesn't help you really lose, but it won't let you gain. You remain at your level. Now, it also will say if you follow eating guidelines and exercise guidelines, like any other diet, it can help you lose weight. Most importantly, it's a biguanide medication. It's not a GLP-1 like Ozempic. What I like about this, even though they're trying to sell these drugs to you as a member of the public, is it says right here they don't understand the exact way it helps you lose weight, and that it is a weight loss neutral, a weight neutral medication, so it doesn't cause significant weight loss or weight gain. Most importantly, this is off-label. Now, we've discussed off-label before because, as I've told you, I am on an off-label medication for my rare condition. Some insurances will pay for off-labels, some will not. I am fortunate enough that my insurance does now cover it, though I have for years paid for my own medication. I don't take a GLP-1. I don't believe in this trend, simply because I have to sometimes have glucagon IVs, and that means I temporarily go on sliding scale insulin. And I'm going to tell you something. The older I get, the more I have pancreatic pain or pain in that region and pain in my liver when I'm put on insulin in ICU. I can only imagine for non-diabetics being put on a GLP-1 or, say, metformin for weight control. I just have the feeling there's going to be some long-term effects that we don't know yet, because this is a relatively new trend, and I am kind of frightened how I'm seeing people use drugs off-label kind of willy-nilly. Now, if you're on a GLP-1 and it's working, God bless you. I'm happy. I am not going to say it, Dani. I've watched too much Dani. I'm not going to say bottom line. I'm not going to say at the end of the day. The end result is, if you want to lose weight, you need to eat less, eat smarter, and move more. Period. Everybody. I don't care if you're bedbound. I have had patients who are completely bedbound, and we can do exercises in bed. There are chair exercises. There are exercises if you have a bad back, if you have a bad foot, if you have a halo on your neck. I don't care. There are exercises out there. It's all about what you consume, how much you consume, and how much energy you expend. And yes, it's easier said than done, but the fact remains, that is how you lose weight and get healthy. 3 eggs, 2 pieces of toast, and 6 pieces of bacon is not the answer. And drugs aren't going to help you, or they're going to be a temporary fix. Just like weight loss surgery. If you don't go through with the behavioral modifications and the therapy before you have gastric bypass, you are going to blow out your bypass, you're going to stretch your stomach, and you're going to gain weight. Period. Now, as far as metformin and antipsychotics, 5% of the patients found that they ended up losing weight. In the study, Annals of Internal Medicine, the one study showed that most of the patients remained at their own weight. But that was without any exertion, without changing diet. Those who did change their diet and who did adhere to a walking plan or a swimming plan or an exercise plan of some sort lost weight, 5%. So the starting dose for somebody who is on antipsychotics to keep them from gaining too much weight, the starting dose is 250 to 375 milligrams taken 2 to 3 times a day. So your total is 750 to 1,000 milligrams per day. And that can be increased every week until you reach your max dose of 2550. With the extended release tablets, your starting dose is lower. It's 500 a day. And then they can increase it every few weeks, not weekly, but every few weeks by 500 milligrams until you get to a max dose of 2,000 milligrams per day, because extended release has a different half-life. So they have to watch that you don't go over. So it's a little bit lower. So as you can see, metformin has not been FDA approved for weight loss. A lot of these drugs are not approved. That said, the analysis showed effectiveness of metformin for weight loss found typical dosing in studies was between 1,000 and 2,000 milligrams a day, with one study using max dose 2,550 per day. And the analysis showed that after 6 months, the participants' body mass index, their BMI, decreased approximately 1 point. I'm sorry. It's my personal opinion. That is not worth it. Just my opinion. Risks are pretty serious. Pancreatitis, which I would not wish on my worst enemy, is so painful. Hepatitis, abnormal blood clotting, vitamin B12 deficiency, and reactive hypoglycemia. I wouldn't do that. If you have PCOS or you are premenopausal, it can increase the risk of unintended pregnancy, which I guess we don't have a problem with. There's also a black box warning on metformin of lactic acidosis, which is potentially fatal. People with liver problems, with kidney issues, excessive alcohol consumption, and congestive heart failure are at a greater risk of getting lactic acidosis. I will provide the website address, but when you get in, this is what it looks like. Go to the bottom and you will see the list of medications. Go to metformin. It was a little tricky, okay? And it says metformin for weight loss. You want to scroll all the way to the bottom of these cute little boxes. And which one? This one. Metformin dosage guide. And that brings up it's really the best one for layman reading. I mean, it's easy to understand everything. If anyone knows Dani, tell her to go there. My takeaway on this is just my opinion, my humble opinion. Seroquel is a good drug. She needs to give it a chance. She needs to eat better. Go to a dietitian. Your insurance will pay for it. Go to a nutritionist, a dietitian, someone. Have them make up meal plans for you. You adhere to them. You go to physical therapy for your shoulder and ask the doc for a physical therapy for weight loss. Your insurance will pay for it. Insurance wants to do whatever they can to prevent surgery because surgery is expensive. I would go that route and not medical. Because what's more important in the end? Weight gain or staying at 220 or keeping your bipolar in check? I would personally want my mind at ease and have control over my thoughts. I would not, I've told you, the only thing that I'm frightened of is losing my marbles. I really am. And though the drugs are scary, your psychiatrist knows their shit. So if your psychiatrist has prescribed you Seroquel, you take it. The weight can come off. It may be uncomfortable to eat less because you're so much hungrier on this Seroquel. But you know what? You're going to get through it. What's more important is your health and your mind. You can lose weight, gain weight, lose it again. But you can't always control your brain. And if you lose your marbles, what happens to you? Sometimes that ends up being permanent. So I wouldn't fuck with that. If she goes off the Seroquel, that's on her. But we've already seen what happened when she started withdrawing. And that wasn't pretty. And it wasn't funny. That was heartbreaking. Nobody should be that distressed. And much as Dani is histrionic and a hypochondriac, I believe she was in distress that day. And I do believe it was because of her Seroquel starting to leave her system. And do remember that going cold turkey or even wean downs can cause fatal reactions. You don't want NMS. You don't want TD. So if I were her, again, my humble opinion, I would stay on the Seroquel. I would ask my doc stat for a dietitian, nutritionist appointment, get myself meal plans, menus, everything. I would join a gym. I would force myself to go. I would get a personal trainer at the gym. Most gyms nowadays offer you a trainer with membership. And I would just push myself to go. And if she did that, she'd get a lot more viewers and a lot more support. This has been your TED Talk. Oh, wait. Because it's Halloween, Batty has to say goodbye. Goodbye, Dani.